When a joint reaches severe degeneration, cartilage wears thin, bone grinds directly against bone, and everyday movements become a source of constant friction. By the time patients reach this stage, they have typically exhausted the standard clinical playbook. Weeks of physical therapy and basic steroid injections have failed to provide lasting relief, leaving the pain unchecked. Even intermediate regenerative treatments, like platelet-rich plasma, or PRP, struggle to keep up. The joint is degrading faster than those therapies can encourage repair, pushing the patient dangerously close to invasive revision surgery. To intercept that surgery, we turn to the most advanced regenerative approach in modern medicine, stem cell therapy. Because of its biological complexity, this is a premium option strictly reserved for the most advanced cases. It requires a significant commitment, with treatment costs starting from £5,000. When conventional and intermediate methods fail, this cellular intervention serves as the final biological barrier between a dying joint and the surgeon's scalpel. The process is autologous, which is a medical term meaning the resources come directly from you. We harvest mesenchymal stem cells either from your own bone marrow or your adipose, or fat, tissue. There is a major misconception about what happens next. When injected into the joint, these stem cells do not latch on, morph, and grow into fresh layers of bone or cartilage. Instead, they work through a mechanism called paracrine signaling. Think of the stem cell as a biological project manager, sending out complex chemical instructions to coordinate the damaged tissue around it. The first phase of this signaling involves the release of powerful anti-inflammatory molecules. These instructions command the surrounding area to calm down, halting the active degradation of the joint. Next, the stem cell releases anti-apoptotic molecules. Apoptosis is the process of cell death, so these specific signals literally intercept the native degrading cells and stop them from dying. Finally, it deploys restorative molecules. With the environment stabilized, these signals command your joint's existing tissue to wake up and actively rebuild the damaged structural matrix. These cells act as microscopic commanding officers, forcing your failing joint to rescue itself. This specific cellular management system is rigorously documented across multiple peer-reviewed clinical trials. This bar chart visualizes findings from a 2024 Mayo Clinic study on rotator cuff repairs. The first bar represents the standard baseline rate of revision surgeries. The second bar shows the outcome when bone marrow aspirate concentrate is applied, a nearly threefold reduction in the need for a second surgery. We see similar evidence in this line graph from a 2020 randomized controlled trial. Tracking recovery trajectories at the 3-month mark, the line for exercise therapy alone flatlines, while the line representing stem cell therapy shows significant improvements in both function and pain. The long-term data aligns with these findings. A 2025 randomized trial tracking ACL tears documented distinctly positive, sustained outcomes for injection approaches at a 2-year follow-up compared to exercise alone. And the benefits extend beyond the limbs. Published studies on spinal disc conditions report measurable improvements in patient pain ratings and overall quality of life. Across diverse joints and varying timelines, the clinical data proves that introducing cellular project managers alters the trajectory of joint degeneration. Despite the highly successful data, there is a biological reality to consider. Because of the sheer complexity of this intervention, it is not a universal solution for all joint pain. To determine if your joint is physically capable of responding to paracrine signaling, an extensive medical assessment, including a detailed imaging review, is an absolute necessity. We believe in transparent care. If a simpler, less expensive approach, like PRP or focused exercise, will serve you better, we will tell you candidly. The ideal candidate is highly specific. A patient with advanced joint degeneration who has exhausted all simpler options and genuinely requires a targeted cellular intervention. Deploying the body's most foundational cells for a targeted rescue mission is a powerful tool in regenerative medicine, but that power is only realized when it is deployed at the exact right stage of joint failure. To discover exactly where you stand on the escalation ladder of joint repair, reach out today for an honest, imaging-backed consultation.